بسم الله الرحمن الرحيم. الحمد لله رب العالمين، والصلاة والسلام على محمد وعلى آله وصحبه أجمعين. برعاية السيد رئيس جامعة الموصل الأستاذ الدكتور قصي كمال الدين الأحمدي المحترم، وبإشراف السيد عميد كلية الآداب الأستاذ المساعد الدكتور محمد علي محمد عتيل المحترم، تقيم كلية الآداب ممثلة بقسم اللغة الإنجليزية محاضرة إلكترونية بعنوان علم اللغة السريري مساهمة علم اللغة في علم الامراض، يقدمها الأستاذ الدكتور باسم يحيى جاسم، وتدير الحوار والأسئلة والأجوبة الدكتورة وفاء عبداللطيف مشكورة. وقبل أن نبدأ المحاضرة مع دكتور باسم تقدم الدكتورة وفاء الحوار، وأنقل المايك إلى الدكتورة وفاء من أجل إكمال المحاضرة وتقديم الدكتور باسم. تفضلي دكتورة.
شكرا دكتورة، الله يحفظك إن شاء الله، وأشكرك على كل هذا التنظيم وعلى هذا الجهد اللي يعني beyond appreciation. شكرا جزيلا دكتور.
على الرحب والساعة، على الرحب والساعة دكتور، أهلا وسهلا بك.
الله يسلمك. اوكي. طبعا let me say that I have a very short presentation. Dr. Bاسم is going to speak about clinical linguistics. I'm going to speak about the relationship between medicine and literature, because I thought that where I end, linguistics starts, and this is going to be proved by Dr. Bاسم himself. So I want to introduce Dr. Bاسم to you. Dr. Bاسم Yahya Jاسم is a professor of applied linguistics, Department of English, College of Arts, University of Mosul. He got a BA degree in law from the College of Law, University of Mosul, and a PhD degree from the College of Arts, University of Baghdad. He read his research papers in international conferences in Malta, Turkey, Serbia, Italy, Poland, Greece, Azerbaijan, Russia, and the United States. His major interests are language teaching, forensic linguistics, clinical linguistics, and critical thinking, and has a number of international publications in these fields. The title of his lecture today is Clinical Linguistics, the Contribution of Linguistics, a Science of Pathology. To tell you the truth, I will take the permission from Dr. Bاسم to add some flavor, let me say, to the lecture he is going to give us, so that I would give some hint into the relationship between language and literature. So I will show this through my presentation, which is a PowerPoint. Okay. Does the PowerPoint appear to you? Is it clear to you? Is it clear to you, the PowerPoint?
Yes, Doctora, go ahead. Yes.
Okay, thank you so much. Actually, I will start from Suzanne Sontag's pioneering book, which is called Illness as Metaphor, which she published in 1978 after she got the disease of breast cancer. It is actually an essay long book, and in this book she speaks about the cultural reception of the disease and the patient, and we will see how she does that. So this controversial book, I think this is can you read this? Can you read this like me? This controversial book-length essay by Suzanne Sontag explores the way in which the figurative language used to describe diseases such as tuberculosis, or which is called TB, and cancer, or it is also called briefly as CA, has often expressed a psychological judgment on people afflicted with these diseases. In effect, Sontag argues that language has sought to blame victims for conditions beyond their control. Actually, this subject, I found it very relevant to our time of the COVID-19, and how the patients are treated in a very inhuman way because when they catch the disease. Nevertheless, it is not only Sontag who spoke about illness and literature. Illness has often been described as a landscape of sorts. In Virginia Woolf's essay on being ill, she writes of undiscovered countries and the terrible waste and deserts of the soul. brought to light by a slight attack of influenza. Charles Lamb's The Convalescent and William Hazlitt's The Sick Chamber, respectively, and the gloomily deem illness as a prison and a dull place where the folding doors of the imagination remain closed. In Hilary Mantel's Meeting the Devil, a mesmerizing description of the author's hallucinatory time recovering in hospital from major surgery, she recounts her first night blighted by morphine, thinking that my bed had grown as wide as the world. And now we come back to Suzanne Sontag and what she wants to say, or she wanted to say in that book after her recovery from breast cancer. She says, we can say about her that her writings primarily focused on cultural attitudes of illness, as this had a serious impact on her life. Her father suffered from pulmonary tuberculosis, a disease that attacks the lungs, which is discussed in greater detail in the early chapters. Sontag herself suffered from acute myelogenous leukemia and died on December 28, 2004. She stands against the idea that argues that the person causes the disease because they do not express themselves emotionally. It is not about the personality traits of the individual, but rather how abstract and dissociated the individual is with life. The sick man himself creates his disease. He is the cause of the disease, and we seek none other. Of course, I want to say here that Suzanne Sontag speaks about two diseases. One, the first one, which spread in the 19th century, which is the TB or tuberculosis in Arabic, السريري, and in the 20th century, the cancer. So she speaks about how people react towards this disease and the feelings the sick has to feel while he is looked upon by the society in a very negative way, being isolated and never spoken to and alienated till he dies out of grief and sadness and isolation. Sontag argues that specific emotions or characteristics within oneself cause specific diseases. An example of this is that with women. Grief and anxiety are among the most frequent causes of breast cancer. Another example is found among the businessmen and mothers of large families, since they tend to suffer from grief, stress, and are overworked, making them ideal candidates for cancer. Okay. Illness has often been described as a landscape of sorts. In Virginia Woolf's essay on, I think I have read this. So all of these writers delineate their own version of what Suzanne Sontag refers to in illness as metaphor as the division between the kingdom of the well and the kingdom of the sick. So that is what I wanted to say about the relationship between literature and illness, and I can give examples about writers who suffered from isolation because of their diseases and the reason why they caught that disease. Franz Kafka, everyone knows him. Franz Kafka and John Keats, they died of consumption. Look at the word consumption. Consumption means it is taken from the word consume, and people believe that or in the 19th century, they believed that people who catch the disease of TB or tuberculosis or the consumption is related to their love being consumed by passion or unfulfilled emotions. And we know from their personal life, like Franz Kafka and Keats, they caught TB because of their emotional problems. Poe also died at the age of 40. Some say that he caught also a disease. At the time of the Cold War, for instance, communism was described. Now we come to the political arena. Some politicians use some disease metaphors or illness as metaphor to describe or to market or to sell certain political ideas. When communism, for instance, was described as bureaucratic cancer, the bureaucratic cancer. Suzanne Sontag also gives example from classic philosophy that draws upon the classic interpretation of psychological disturbances of humor. You remember the comedies of the human, or the rise of the comedy of the humors. Those and the humors, you know, they are, medically speaking, they are related to the four liquids in the human body: the blood, the stool, the sweat, and the water. Any increase of any of these makes you sick in humor. Like when you have some problem in the bile, يعني في المرارة, you will look like you are pale, or you have very pale, you will suffer from pallor of the face, etc. Okay. Now, at the time of Hitler, when he had performed the Holocaust, he was saying that the Jews are cancer, I have to eradicate them. This is one of his speeches. In the same vein, Stalinism was called a syphilis. A syphilis, you know, this sexually transmitted diseases, STD. And Stalinism is a syphilis that needs to be cured. In this way, you can see how medical language was used in order to sell some ideas, in order to sell ideology, and in order to speak about certain ideas to be convincing. I think now it is enough for me to stop here, and I will give the floor to Dr. Bاسم, and I think he will start from where I ended. Dr. Bاسم, the floor is for you.
Thank you very much. The present lecture is an overview of a relatively new offshoot of applied linguistics, namely clinical linguistics, which tries to establish a link between linguistic science and methodology on one hand, and medicine on the other, especially pathology. It shows how linguistics or linguistic science can be useful in the description, identification, and the treatment of language disorder. Now, let me start with the objectives. This one. الشير انتهى مع الشير. انت ما تعرف الشير شوي بس رجع ما عندي الشير. اي ما هسه صار شير.
دكتور كلمة present now دوسها تطلع full screen, your entire screen. Okay. نجحت.
يلا يس
It works now.
لا لا تطلع على هذه.
Yeah,
Is it
yeah.
okay?
Yes, yeah. You can see.
Yes. So my lecture is, yes. So my lecture is entitled "The Clinical Linguistics: The Contribution of Linguistic Science to Pathology." Let me start with the objectives of this lecture. The present lecture aims at introducing clinical linguistics as a branch of applied linguistics and its implications to language pathology. It tries to show how clinical linguistics can contribute to the identification, assessment, treatment of the language disorders. Emphasis will be placed on two disorders, namely stuttering and autism, owing to the pressure of time. Let me start with pathology. You know that in order to make a link between pathology and language disorders or clinical linguistics, pathology is the study of the nature, causes, effects, and development of abnormal conditions that occur as a result of a disease. Now, what is a disease? A disease is a reduction in health as a consequence of failure of equilibrium in the body as a branch of general parts. Now, language pathology as part of general pathology covers all disorders in linguistic communication, sorry, linguistic, not linguistics, in linguistic communication, including those of speech, hearing, writing, and signing, not singing, sorry, and signing. So language pathology in particular is concerned with identification, evaluation, intervention, and prevention of communication disorders. So communication disorders may arise in the encoding and or decoding of the message intended to convey. Now, language pathology involves impairment in speech sound production or in speech sound production. For example, articulation and apraxia. In voice, in the case of phonation and pitch. Fluency, such as stuttering and stammering. Language, in language comprehension and or production. And in the cognition, that is, disorders that may affect attention and memory. So the study of communication disorders requires knowledge of two disciplines, two completely different disciplines, medicine and linguistics. Let me start with defining clinical linguistics. In fact, different definitions have been introduced in the literature. I'll select two currently used definitions. Clinical linguistics is basically concerned with the application of linguistic science to the study of communication disability. This definition is the earliest definition to the clinical linguistics introduced by David Crystal in his seminal book, Clinical Linguistics, published in 1981. Is it clear? Is everything clear?
Everything is
Yes, Doctor, everything is.
Go ahead.
Is it
Go
okay?
ahead, go ahead, yeah, please.
Thank you. Well, now, Disability here is the key word in this definition. Disability includes deprivation, deficit, dysfunction, disturbance in the use of language which requires special treatment. Another definition, which is more technical, which is more technically oriented definition, is provided by Perkins and Howard, 2011. For them, clinical linguistics is concerned with the use of linguistics to describe, analyze, assess, diagnose, and treat communication disorders. Now, from these two definitions, one may infer that any clinical analysis of language involves two types of knowledge. A, knowledge of how language is represented in the mind of the individual, how it is organized, again in the mind, and how it is produced using articulators or encoded and comprehended or decoded in normal communication. The second type of knowledge is knowledge of the location of language impairment and how abnormal language differs from the norm. So in the production, we start with thought. By the way, dysfunction or deficit may occur in any of these stages. So in a production, we usually start with thought, what we have in mind. Then we move to what is intended to communicate, how we use the idea in order to perform a specific communicative function. And then we move to the encoding stage. In this stage, we use specific symbols, oral or graphic symbols, in order to voice our ideas. Then we utilize neural muscular articulator in order to verbalize the message we want to send. In recognition, the process here is reversed. The message is received, and then there is a control of the mechanical vibration, and then the cochlea of the inner ear, then to the auditory nerves, and then to the brain. The communication disorder may affect any of these stages. Types of language disorders. There are three main types of language disorders. Number one, expressive language disorders, such as finding trouble in getting the message across. That is, difficulty in pronouncing words or putting words in meaningful sentences. Receptive language disorders. In this type of disorder, we find patients find difficulty in comprehending others' intention. That is, to get the meaning of what others are saying. Or we can have mixed language disorders. In this case, there is a type of struggle with both expressive and receptive types of language disorder. In this case, the patient finds difficulty in encoding and decoding messages. Now, the contribution of the linguistic science. What's the contribution of the linguistic science in diagnosing and the treatment of language disorders. Communication disorders, as you know, are of various types, and identifying, describing, and treating them entail drawing on different fields of linguistics. We may draw on phonetics, phonology, morphology, syntax, semantics, pragmatics, and discourse analysis. In fact, all these subfields of linguistics or subdisciplines of linguistics are relevant in one way or another in identifying, describing, or treating language disorders. Below are the relevance of each linguistic field, and the level of linguistic analysis will be pointed out. Let us start with phonetics. You know that phonetics is basically concerned with the description of how speech sounds are produced, how speech and how speech sounds are transmitted from the mouth of the speaker to the ear of the listener, and auditor, and how the message is decoded in the mind of the listener. This is why we have three subtypes of phonetics. We have articulatory phonetics, which is concerned with how speech sounds are produced, and acoustic phonetics, which is concerned with how speech sounds are transmitted, and auditory phonetics, how sounds are decoded. So when talking about articulatory phonetics, we are concerned with segmental and supra-segmental features, and when talking about acoustic phonetics, we are concerned with, with the frequency and modulation, and auditory phonetics, we are concerned with how sounds are perceived and how the message is typically decoded, interpreted, and understood. I'll show later how phonetics can be useful in the description, identification, and the treatment of certain language, or in fact, speech disorders such as stuttering and stammering. Now, phonology, phonology is concerned with how speech sounds function as a system of contrasts to make a distinction in meaning. So in phonology, we are not concerned with individual sounds, we are concerned with structure. We are concerned with how speech sounds function. Now, phonology is relevant to clinical linguistics to the extent that a new subdiscipline of clinical linguistics has been developed named clinical phonology. So clinical phonology is a subfield of clinical linguistics. It is concerned with the application of theoretical phonology, its methods and techniques to identify, classify, describe, assess abnormal production and or comprehension of speech impairment. Now, in fact, where abnormality here, I say abnormal, where abnormality here, now in phonology, in clinical phonology, the clinical phonologist is required to provide answers to the following question: where does abnormality occur? Does it occur in the production or in the recognition of speech sounds? Which speech sounds? Why? Why, for example, why do some people, or especially children, are unable to distinguish between, in Arabic, tan, usin, utan? All of them are pronounced as tin. So where does the atypical pronunciation lie and why? So such atypical speech can be captured by phonetic or phonemic transcription. In fact, no level of linguistic analysis is immune to language disorders. Morphology, for example, is another branch of linguistics. You know that morphology is concerned with the study of the internal structure of words. Now, morphological analysis is relevant when analyzing a typical language of schizophrenic patients who find difficulty in the inflections or grammatical morphemes. It has been found by many studies that schizophrenic patients are unable to use inflections in the appropriate way or grammatical morphemes. That's to say, they find difficulty in suffixes, for example, in inflectional suffixes. That's to say, they usually use to delete third person singular s, genitive s, plural s, and in derivational suffixes, they usually they cannot change a word from noun into verb, from a verb into adjective, from an adjective into adverb, etc., etc. So morphology is also relevant in clinical linguistics. Syntax. Syntax is concerned with how words are arranged to form a meaningful sentence. So it is concerned with the internal structure of sentences. Syntactic analysis is appealed to when analyzing language impairment. For example, a phasic patient omits articles, function words, and sometimes produces telegraphic agrammatical sentences. Autistic children also produce single word utterances, and fail to construct interrogative sentences. Now, let us now move to semantics. Semantics is concerned with the meaning of linguistic entities such as words, phrase, words, and sentences. Now, in semantics, we are basically concerned with how words are become meaningful and the relationship between words at paradigmatic level and at the syntagmatic level. At the paradigmatic level, we are basically concerned with synonymy, antonymy, hyponymy, etc. And at the syntagmatic level, we are concerned with collocation in particular. So these are also, now in semantics, we are also concerned with sentence relations. In this case, we are concerned with entailment, logical relations, inclusions, contradictions. All these aspects are relevant in the semantic analysis of abnormal language. For example, patients with dyslexia find difficulty in reading and understanding words with abstract meaning. They are able to understand words with concrete meaning, but they fail to understand or read sometimes words with abstract meaning. Also, aphasic patients have a problem with naming things. They are unable to name things. They give their synonyms, but they find difficulty sometimes in naming things. Children with Down's syndrome may fail to use and comprehend locative prepositions in, on, at, etc. They are unable to distinguish between in, on, at as locative prepositions. Now, pragmatics. You know that different definitions have been provided for pragmatics. For each, pragmatics is the ability of language users to pair sentences with context in which they are appropriate. And the first definition is taken from Levinson in 1983. The second definition is provided by Leach. For him, pragmatics is the study of meaning in use. And for you, the study of contextual meaning. It seems to me that a more relevant definition can be provided here for pragmatics. It seems to me that pragmatics is the study of the intended meaning of the speaker in a given context, and how such meaning is negotiated or understood by the hearer. So one expression may have different meanings in different contexts with different persons in different situations. Like, for example, اتفضل may have different meanings in different contexts, and I have no time to explain this now. As you know, basic to pragmatics are the notion of speech acts, the use of utterance to perform specific functions like threatening, warning, thanking. Now, by the way, I mention all these things because these things are relevant in the analysis of the language of the autistic children in particular, and in aphasic children. This is why I explain or I detail these things in pragmatics. Implicature. Implicature is an important notion in pragmatics. It is usually defined as the implication which speakers and listeners rely on in the production and interpretation of utterances, and we also have presuppositions, what the speaker assumes on the part of the listener. All these are relevant in the pragmatic analysis. The pragmatic analysis is so relevant to communication disorders that a new subdiscipline of clinical linguistics has been developed, namely clinical pragmatics. Clinical pragmatics. So clinical pragmatics is a subdiscipline of clinical linguistics which tries to study language disorders from the pragmatic point of view, especially the language of autistic children and the language of aphasic patients. Now, so a child, so clinical pragmatics is concerned with the characterization, assessment, and the treatment of pragmatic disorders and communication impairment in children and adults. A child or adult may So a child or adult may experience a pragmatic impairment as a result of a brain damage, a stroke, a trauma, or mental illness such as Alzheimer's disease, schizophrenia, and dementia. Typical pragmatic deficit in children with autism are difficulty in comprehending irony, metaphor, or in using features of context in utterance interpretation. They fail to make inferences of context and understanding speakers' intentions. So here, all the three fields of pragmatics, namely speech acts, the intention of the speaker in presupposition, and implicature are relevant here. Typical pragmatic impairment in dementia, for example, are impaired comprehension of figurative language, problems with the use of cohesive devices. More details, of course, will be mentioned when talking about autism. Now, what is the job of the applied linguist in clinical linguistics? There are 5 jobs for the applied linguist. The first job is clarification. In this step, his job is to identify the area of confusion or deficit. Is it stuttering, dyslexia, autistic spectrum disorder, aphasia, or what? The second step, or the second job, is to describe what has been identified. That is, describing and analyzing the linguistic behavior of the patient and analyzing the language deficit he or she suffers from. The third job is diagnosis. That is, he is required to diagnose what is wrong. His job here is to classify the type of linguistic disorders, the causes of the problem identified, whether it is neurological, anatomic, physiological, purely linguistic, etc. The other job is assessment. Here, he is required to provide an answer to the following question: how much or to what extent is the patient abnormal? How seriously the patient is deviant from the norm? So he is required to show the extent to which the patient is abnormal and to what extent his case is deviant from the norm. In the case of intervention, what is informed, he is required to answer the following question: what informed insights the clinical linguist can provide the doctor to arrive at appropriate decision concerning diagnosis and the treatment of a given linguistic disorder? Now, I am going to talk about 2 cases of language disorder. As I said, because of the pressure of time, 2 cases of language impairment are going to be dealt with in detail, namely stuttering as an example of a speech disorder and autism as an example of language disorder. Now, let me start with stuttering. Stuttering is a speech disorder which is characterized by the following. Number 1, repetition of sounds, syllables, or words. 2, prolongation of specific sounds. Or sometimes a speech disruption. Now, speech disruption may be accompanied by struggle behavior. He wants to eat struggles to produce the word or the sound. This prolongation or repetition is usually accompanied by rapid eye blinks or by tremors of the lips. What are the sources of the development? What are the sources of stuttering? We have 3 sources: developmental stuttering, neurogenic stuttering and psychogenic stuttering caused by emotional trauma. In the developmental stuttering, this type of stuttering occurs in children while learning speech and language skills. This type of disorder may run in families, so they may have we may have genetic factors. Is it okay? Do you hear me?
Yes.
Okay, we can hear you.
Well, psychogenic stuttering may occur after stroke, head trauma, or brain injury. In this case, brain may have difficulty coordinating regions involved in speaking. And in psychogenic aphasia, this type of aphasia is usually caused by emotional trauma. I don't want to go in detail in these things, but this is just to mention in order this in passing. Diagnosing stuttering. How can stuttering be diagnosed by the clinical linguist? The first step is to study the child's case history. This is an important point to start with. The second step is to analyze the child's speech and language behavior. Okay? So here, the clinical linguist is required to identify the sounds, the syllables, or the words in which the patient usually stutters. Then evaluation of the child's speech and language ability. Then he has to study the impact of stuttering on the patient's life. And number 5, the clinical linguist is expected to study the family history of stuttering because it has a consequence on their children's stuttering. Then finally, he should study stuttering in relation to other language problems, whether there is or there isn't other language problems. How is stuttering treated? The job of the linguist is to suggest ways for treating stuttering. These suggestions are expected to be taken into consideration by the therapist, by the teachers, or by the parents. But we should start from the beginning to say that no cure for stuttering. Yet, a variety of treatments are available. Number 1, parents should support their children's production, but they shouldn't produce the words their children want to convey. 2, listening and attending to children focusing on content. One of the suggestions provided by the clinical linguist to the teachers and to the parents is to listen and attend to children while speaking, focusing on the problem, focusing on the content of the message rather than on the form of the message. The clinical linguist also suggests that a relaxed home environment should be provided to the stutterer. Number 4, parents are advised not to try to complete the children's sentence. Leave the child speak. Leave the child speak the whole sentence. Don't complete your child's or the stutterer's sentence. The parents are also asked to speak slowly to the children. Yet, there are, of course, drugs that are usually used as a therapy, medication for epilepsy, anxiety, and depression may be used for the stutterers. Another very important and pervasive, in fact, language disorder is autistic spectrum disorder. This is not speech disorder, it is a language disorder. Now, the difference between the two is that in speech disorder, emphasis is placed on performance, whereas in language disorder, emphasis is placed on competence. There is a sort of dysfunction of competence of the language. Autistic spectrum disorder, اللي هو التوحد, was first identified by Leo Kana in 1942. It is defined as a developmental brain disorder, typically results in difficulties in responding to others, in social interaction, difficulty in social interaction, and in receptive and expressive language abilities. I'll start with identifying the clinical systems of autism before I come to the linguistic symptoms of autism. Let me start with the clinical systems of autism. The following are the clinical systems. Number one, lack of smiling. Autistic child rarely smiles and rarely babbles. He is the autistic child shows extreme unresponsiveness to others, to anything that comes from the outside world. He pays no attention to others. He pays no attention to sounds, to people, to animals, to anything in the outside world. The autistic child has a powerful desire to be alone and to repeat things on and on. So he has a powerful desire to aloneness and sameness. He keeps repeating, doing things on and on, time after time. He rarely makes eye contact with others. He rarely makes contacts with his parents or peers. And he never cares about people around him. Also, clinical linguist, autistic child exhibits repetitive and stereotyped behavioral patterns. For example, spending hours spinning objects, rocking their bodies, lining up or stocking items, hand flapping, squealing, twitching, or head banging. Of course, these clinical systems have been identified by Diagnostic and Statistical Manual of Mental Disorder, DSM-14-2000. Now, causes of autism. 3 causes have been identified in the literature: environmental, genetic, and cognitive. environmental
Dr. Bاسم, you have another account. You have another account at Google Meet. I think it is open. You can use it. Nice money.
The internet keeps disconnecting.
Yeah, unfortunately, I have just got that problem also, but I came back soon.
نعطيه فرصة للعودة دكتورة، احتمال النت انقطع عنده.
لا طبعا طبعا we are waiting. ننتظر دكتور.
Dr. Wafaa, any problem?
I think Dr. Bاسم has a problem with the electricity.
Maybe a problem.
Yeah, power outage. Yeah, power outage, I think.
Oh.
Ustad Nazar, I agree with you, with what you have written here. Nice to see you here.
Thank you, Dr. Wafaa. Thank you very much. You know, I have a son with autism. For that reason, I am very concerned about the labeling kids with all these features, because he's a very social person and he smiles a lot, but he's a nonverbal. So I just wanted to say that. Thank you, Dr. Wafaa.
Yes, the symptoms of autism and all the diseases that he has mentioned, I think they are very able to be diagnosed by any other means, not only by linguistics. Easier ways like the NMR, like the most developed very advanced machines we have now in medicine to diagnose these diseases. But it is very beautiful, and it's very news to me to know that linguistics has become a diagnostics field.
Yes, it's very beautiful to see Nazar, actually. It's very beautiful to see Nazar and Radwan here again after all these years. Nazar, how are you?
Alhamdulillah. Thank you, Dr. Marwan. Thank you very much. Thank you. Thank you to all of you. Thank you, Dr. Bاسم, Dr. Hussein, Dr. Qutayba. Thank you, all of you. Thank you very much.
طبعا أستاذ نزار from America. He is here.
Sorry, I haven't finished yet.
Yes, okay, Dr. Bاسم.
دكتور انضم علينا دكتور باسم. تفضل دكتور باسم.
He's back.
Well,
yeah, he's back now.
It's okay? It's okay?
Yeah, the floor is for you now. Please, please go ahead.
Now, causes of autism. There are three causes. Three causes have been identified in the literature: environmental, genetic, and cognitive neurological. Environmental cause. In the environmental causes, point to cold and ungiving family preoccupied with jobs. You know that nowadays most of the people are preoccupied with their jobs, leaving their children paying no attention to them. The genetic case or the genetic cause, some point to the identical twins, sibling, brain weight of autistic children, at least single gene disorders in the chromosomal abnormalities. All these things are expected to be the cause of, or the causes of autism. Some argue that cognition deficit, weak control, coherence, or cognition is the real cause of autism. I don't want to dwell on these causes. Our immediate concern is the linguistic aspects of autism. To begin with, 50% of autistic children have no single words by 24 months and no phrase speech by 30 months. They show slow, they were slow, or they are slow at putting words into meaningful sentences. They use words idiosyncratically, and they usually use stereotypical phrases and echolalia. They show, or they are trouble. They find difficulty with following long or complex utterances. Now, all these are these are some of the important linguistic aspects of autistic children. Now, what is the job of the clinical linguist in the case of autistic children? The first step is identification and description of the language impairment in specific or in particular. Where does language impairment lie in the autistic children? At the phonological level, for example, that is in producing odd sounds, odd words, and verbatim repetition. Does it lie at the lexical level? That is, using limited number of words, doesn't use already learned words, deficit in using deictic words that refer to time, place, and person, deficit in using pronouns or pronoun reversal, or in echolalia, repeating for him or herself what was said. So where does the real problem lie as far as the lexical level is concerned? Now, at the grammatical level. At the grammatical level, it is found that autistic child shows slow or is slow in putting words into sentences. So does he suffer? Does the autistic child he is studying shows is slow in putting words into sentences? Does the autistic child omit articles, auxiliary verbs, third person singular s, as has been found in the literature? Is the autistic child indifferent to tense? That's to say, he is unable to distinguish between present and past tense. Does he confuse? Does the autistic child he is investigating, does he confuse using second and third person pronouns? Is the autistic child unable to produce long sentences? So all these things should be asked by the clinical linguist when describing, when identifying the type and the shape of autistic deficit. Now, at the pragmatic level, we usually find that autistic child, typically, autistic child shows deficit in seeking and sharing information with others, in getting others' attention, in understanding others' intentions and ideas. He shows dysfunction or deficit in understanding jokes, in understanding metaphors, and in using indirect speech. He is unable to understand others' minds. As I said, these aspects of autistic children have been identified in the literature. So, does the child, he is at hand, he is investigating, suffer from these deficits or not? And which one is more prominent? In diagnosis, the clinical linguist is expected to tell us what is wrong. He is required to classify the autistic child's abnormal behavior. As I said, is it phonological, lexical, pragmatic, syntactic, etc.? What are the causes of the atypical behavior? Sociological, psychological, or genetic? In the assessment phase, the clinical linguist is expected to tell us to what extent the patient is abnormal. Here we have linguistic and non-linguistic assessment. In non-linguistic assessment, he should show the standards test for autism, and he should seek for information from parents and teachers by making interviews with the autistic child's parents and teachers. In the linguistic assessment, he is required to assess the deficit and its type. You know that each type of deficit is assessed in a specific way. Semantic competence, for example, can be assessed through lexical relations. And as I said, we have two types of relation: paradigmatic and syntagmatic relations. Grammatical competence can be assessed by asking the autistic child to do a number of drillings. Pragmatic competence can be assessed by observing the child while using the language in a range of contexts and situations, as when communicating with others. And finally, intervention. Each case, you know that, as I have just said, each case in autism is unique and needs a special program to match the type of the deficit. Now, the clinical linguist suggests alternative methods and techniques. Now, here, the job of the clinical linguist is completely different from the job of a speech therapist. The clinical linguist suggests alternative methods and techniques, while the therapist, parents, teachers, are expected to choose from the alternatives introduced by the clinical linguist. Sorry for the spelling mistakes. Now, what is the greatest challenge for the clinical linguist? The greatest challenge for the clinical linguist, is to develop communication skills in autistic children to their end, because most of the autistic children are unresponsive. They pay no attention to their teachers, to their parents, or other people. So the real challenge is to develop in the autistic child communication skills to the end. The following steps, I suggest the following steps. You see, these are my own suggestions. Number one, incorporating the autistic child in structured play or opportunities, like using, for example, visual clues, picture strip stories, physical activities, etc. Devising techniques to draw his attention, helping the child to participate in social intervention, in social events, giving them time to process information because they have cognitive delay. Not cognitive delay, because they have cognitive delay. And finally, teaching them rules of conversation. You know that most of these suggestions are pragmatically oriented. Conclusion. To conclude, clinical linguistics can provide deep insights into how communication disorders can be identified, classified, assessed, and treated, drawing on linguistic theories, research findings, and methods of analysis. Yet, the work of the clinical linguist is rather complementary than alternative to the work of the physician or pathologist, since each has his own methods and approaches in dealing with language disorders and how they can best be diagnosed, assessed, and treated. Thank you very much for attentive listening. Thank you very much again, my dear colleagues and friends.
Thank you very much, Dr. Bاسم, for this very intriguing lecture and wonderful effort.
Well done, well done, well done.
Yeah, good job.
Thank you.
Okay, before I start or I open the discussion or the questions to be addressed to you, I would like to just to ask one question, Dr. Bاسم.
Yes.
If linguistics has become a field of diagnostics, as it has become a field of diagnostics of some diseases, right? Yes. Okay. It is possible to diagnose diseases like Alzheimer's, schizophrenia, dementia, dyslexia, stuttering, asphasia, echolalia, all these symptoms, autism. Okay. Don't you think that we have other far more advanced way of diagnosing these important, very serious diseases of the mind, actually, mental diseases, rather than linguistics? Thank you.
Well, in fact, I cannot cover all the language disorders. I have singled out only two language disorders. One speech disorder and the other one is language disorder. I know that aphasia is an important language disorder, but I cannot cover it within this because it is highly pervasive. Yes, please.
Okay, there are questions. Dr. Hussein, do you like to ask questions? I think you are ready to ask. Or because there are questions in the chat. Okay.
To comment, in fact, okay?
Okay, the floor for you. Thank you.
Okay. In fact, hello to all my friends. Some of them, in fact, I haven't seen them for ages. So my greetings to all of you and good evening to all of you. In my own way of analyzing things, I think all of us, we are pronouncing the word disease in the wrong way. It is not disease, it is dis-ease. Ease is a state of being comfortable and relaxed. And the opposite of it is this. So it is dis-ease and it is not. That's my own analysis of the word. Yeah. Okay.
Yeah.
The second point is that you see, this is, I think, it is reflected in language in two ways, or it leads, in fact, to language disorder and impairment. This impairment, we can classify it into two main categories. That is what is tangible and what is abstract. Tangible, I think the things that my dear colleague Dr. Bاسم referred to, for example, language production, things which happen with additions, deletions, and explanations. We have also to refer to the abstract part of it or side of it, that is memory. What effects does it have on memory, for example, Alzheimer and all these things? The other point is, you see, we were talking about some, you see, parts of it. Does it lead to any language loss or what we call language attrition or not? Okay. For example, does it lead? I think, yeah, it leads when people, for example, when they have tumors in the brain. By the way, I think in the first part of the lecture, reference was made to the word mind. No, it is never the mind, it is the word brain. And if anybody who is interested in this, and I think all of you have come across it, it is in George Yule's book, The Study of Language, I think chapter 2 or 3, Language and the Brain. He sheds light on many, many things that my dear colleague, Dr. Bاسم has referred to. I have a question, Dr. Bاسم. Do these symptoms of autism and I think the stuttering, do they vary from one context to another? Or they are something, for example, they say universal, let's say. Yes?
It seems to me that they are universal. This type of speech order is pervasive and universal. It is found in almost all cultures, in all societies, in all nations. This has nothing to do with culture. So this is why it seems to me that it is pervasive and it is non-culture bound.
Okay, I don't want to take my colleague's time. In fact, I have another question. Concerning
the language loss, in fact, language loss is a special type of total aphasia. So language loss is dealt with when if I talk about aphasia. It is usually called total aphasia. Yeah, or language attrition. You see, I think you have elaborated or enlarged upon the role played by the applied linguist. Are we practicing that role, or everything is left to physicians in our context? I couldn't find a place to practice such things. But you see, I hope, because we have a lot of schools for rehabilitation of autistic children in Mosul. Yes. Yeah. Thank you very much. Thank you, Dr. Wafaa. Thanks a lot.
You are most welcome, Dr. Hussein. We are most honored to have you today here.
Many thanks.
Thank you.
Dr. Wafaa, can I have a question?
Yes, please, Dr. Marwan. Go ahead.
Yes, I will start from the last point Dr. Bاسم talked about, and probably it is the same point that Dr. Hussein, probably the last point that Dr. Hussein raised. Do you think, to what extent do you think this is used practically? Because I think this is all only still on paper. Because, you know, as you said at the end of your lecture, you said that the physician has his own approach and the clinical linguist has his own approach. So, to what level they have arrived in their collaboration, or to what extent this can be made practical? Well, I'm not talking about Iraq, I'm talking worldwide.
Well, yes, you are right, but we all know that theory precedes practice. So clinical linguistics is in its infancy. Nowadays, it seems to me that in the future, it will be more practical. Thank you for contribution.
Thank you, Dr. Bاسم.
Yes, sir, please. Any other question?
Sorry, Dr. Wafaa, can I ask a question, please?
Of course.
Yes, please.
Yes. Thank you, Dr. Bاسm. You know, you refer to two kind of condition, Down syndrome. My daughter, who is 13, she is with Down syndrome. And my son, who is 21, he has autism as well. So my question to you is about Down syndrome. So you referred in one of your slides about the difficulty of discriminating, like between the prepositions on, in, at. Is this like also universal, or is it like in some cases, is it very common? Because I don't see that in my daughter. She has the ability to differentiate and use them properly in different contexts. So that's my question. Thank you again for your presentation.
Well, in fact, Down's syndrome is outside the scope of my lecture. It needs a specific treatment as far as linguistic assessment and identification is required. So it is outside the scope of my lecture. Thank you very much.
Thank you, sir. Thank you.
Thank you, Ustad Nizar. Okay, we have questions in the chat.
Yeah.
Yeah.
I raised, excuse me. Good evening, everybody.
No.
This is
Good
Rahman
evening.
from Abu Dhabi.
Oh, yeah. Okay.
Most welcome.
Yeah. How are you, gentlemen? How are you, Miss Dr. Wafaa? How are you, Dr. Hussein?
Alhamdulillah, we are welcome. You are welcome.
We miss you a lot, wallahi, to be honest. Mr. Nizar, also Dr. Bاسم.
We miss you too.
Yeah, we enjoy
Okay.
the lecture, actually, the presentation. I raised actually some questions. I put them in the chat room, actually, but you can read them there. But if the time allows, I can raise them first. I have 4 questions. Either you can, I can say them, the 4 questions, then you answer them one by one, or I can raise question by question. So what do you prefer, Dr. Bاسم?
Yes.
One by one?
As you like, as you wish.
Now, my first question is, how can aphasia be identified linguistically?
Yeah, we have things for it here.
Well, yes, Mr.
Dr. Bاسم.
How can aphasia be identified linguistically?
Good. Well, in fact, although, as I have just said, is outside the scope of my lecture yet, aphasia, in fact, is a language impairment due to brain damage, which leads to maybe difficulty in understanding and or producing language. The most common cause of aphasia is a stroke or a traumatic head injury. Different types of aphasia as far as linguistics is concerned.
May I say something, Dr. Bاسم? Dr. Wafaa, please.
Yeah.
Please?
Yes.
Yes, Dr. Hussein. Yes, please. Yes, Dr. Hussein.
Dr. Wafaa?
Yes, we are with you.
Yeah, please. Concerning this question, concerning this question, and I think the doctor who asked it, I think he can find. You see, this is a very, very detailed topic, and I think Dr. Bاسم is not ready to answer all the questions. Questions posed here. If my colleague wants to have a detailed answer to his question concerning aphasia and this thing, I think he will find it in that chapter, language and the brain. Yeah, I think the focus is there on aphasia and a language disorder impairment, and the linguistics aspects are there as well.
Yeah, thank you, Dr. Hussein.
Yes, nonetheless,
thank you.
Yes, to your knowledge, I think that aphasia can be expressive, can be agrammatical, can be receptive, and sometimes it can be total aphasia, in which the patient is unable to produce or comprehend linguistic data or linguistic messages. So I think that this is the main points, although it is outside the scope of my lecture. It needs a separate lecture, in fact.
Yeah, you're right.
Any other question?
Yeah. And my second question, Dr. Bاسم, my second question, is there any difference between stuttering and stammering?
Yes, in fact. In fact, in stuttering, we usually have repetition of a speech sound or a syllable in a word. Like, for example, when we want to say Samir.
Yeah.
Whereas in stammering, we usually have interruption in the fluency of speech sounds.
Okay,
We have interruption of fluency. So, and so there is a sort of a topic inside the word. Like, for example, when I say, for example, Samir, say Samir. So there is a sort of a block inside the word, and then the word is pronounced as one shot. Yes.
Yeah, thank you so much. My third question is there any difference between speech disorders and language disorder?
Yes, yes, for sure. Speech disorder has to do with performance, whereas language disorder has to do with competence. This is number one. Number two, it seems to me that in language disorder, we have impairment in the recognition or production of language, whereas in speech disorder, we usually have impairment in the production of some speech sounds.
Yeah, you are right.
Yeah.
And my last question, how far can applied linguistics be useful or used with advanced autistic cases? As you know, because autism is not one case. Okay, we have very simple one, and we have also advanced. Okay, now
it depends on the case. It depends on the case.
Depends on the case.
It depends on the development of that case.
Yeah.
Each case has a specific way of assessment. Each case has a specific way of identification, and each case has a specific way of treatment. So the job of the linguist is to provide full description of the autistic, of the linguistic aspect of that case.
Okay, for different levels.
Yeah. It is not an easy task, of course.
Yeah, okay. Thank you so much again. I appreciate it.
Most welcome.
Thank you so much.
Most welcome.
Thank you, everybody.
Thank you, Ustad Radwan. Okay, there is a question in the chat from Mr. Latif. He asked about how can we distinguish between clinical linguistics and neuro linguistics? What is the difference between the two?
Well, a clinical linguistics is concerned with the language disorders, whereas neurolinguistics is basically concerned with normal way of saying things, with doing things, with the normal cases, with how language is produced, how language is recognized in the normal people. So also neurolinguistics is concerned with the study of the mind and the functions of the brain. Okay? And here is the difference between neurolinguistics and psycholinguistics. Psycholinguistics is concerned with psych, whereas neurolinguistics is concerned with the brain and the functions of the brain.
Thank you very much, Dr. Bاسم. It's very clear question. Very clear answer. Who else? Do you have another question? Anyone has another question?
Doctor, I have a question, please.
Dr. Huda?
Assalamu alaikum.
Alaikum salam.
Hello, everyone. And I would like first to say hello and a big hello to my supervisor, Dr. Hussein Jarjari. And thank you, to Dr. Bاسم, for presenting such an interesting topic in this wonderful lecture. Well, Dr. Bاسم, I was thinking about a question, actually, while you were presenting your lecture. You presented different views in relation to different diseases as far as kids are concerned. I'm thinking about a way. Suppose that I'm an applied linguist, and I would like to work on a topic or a research paper. First of all, I think I'm going to need a consultation from a physician. Is that right?
I'm sorry, I couldn't understand you. Could you repeat your question, if you don't mind?
Okay. Okay. Suppose
what's your question?
applied
Yes.
Suppose Yes, I'm an applied linguist. I would like to work on a topic related to your area, one of the issues raised over here today. First of all, do you think that as a linguist, an applied linguist, don't I need a consultation from a physician, follow his advices actually to collect the data, my corpus, to think about certain procedures to follow, techniques? All these things are big to me actually. What do you think?
I'm sorry, I couldn't understand your question. I think there is
Doctora Huda, I also couldn't catch your words.
Could you write down the question if you don't mind?
Can you go ahead, just go with the question?
Could you write down your question?
With your question only.
I think there is a technical
a problem with
the internet, I think. Do you agree with me, my colleagues?
I can hear you well.
Yes, go ahead with your question, Doctor.
They can't hear you.
Okay. What are the procedures, or there are techniques or procedures to follow in collecting certain corpus or data for on issues related to your area?
What are the corpus? What are the corpus or the data or the procedure to collect the data? If there is any procedure to collect the data?
Well, we have different techniques for collecting the data. I may collect the data if I am concerned with the pragmatic aspects of, let us say, autistic children. I may collect the data from his parents, her or his parents, from his or her teachers, from his or her doctors. All this data is going to be analyzed. So the data can be collected from different sources. Okay? Yes. The data for analysis, you mean?
Yeah. How can I determine that linguistic elements are difficult for the kid to pronounce or to utter? Is it a matter of just
I may use an interview with the child, you see, especially in stuttering or stammering, or sometimes in aphasia. I may conduct an interview with him or her. So different techniques can be used to collect the data to be analyzed.
Yes, thank you. Thank you very much.
Dr. Bاسم and Dr. Wafaa, please.
Yes.
أحمد صالح.
Dr. Wafaa.
نعم.
Dr. Wafaa, but please. It has been my utmost pleasure to be together tonight. In fact, I have a lecture at my pedagogy center and I'm in charge of it, so I have to join them as well. You just excuse me, all right?
Okay, thank you so much. Thanks a lot for being with us.
Okay, I'll see you.
Thank you so much. Good night.
Good night to all of you.
Bye.
شكرا دكتور حسين. مع السلامة دكتور حسين.
Okay, I think we have Ahmed Saleh. Ahmed Saleh, are you from Oklahoma?
Thank you so much. Yes.
Yes, okay, from the United States.
I'm listening to you from the state of Colorado. So my questions, thank you so much, by the way, to Dr. Bاسم for all his effort and for the useful lecture that we have been listening to. So I believe that we need to take into consideration not only children, but also, the students who suffer from stuttering, because we all have had some students who stutter inside the classroom. So we should teach other students to respect their classmates. Otherwise, we all know that the consequences are terrible. We all know that students who are embarrassed to think or to say or to articulate what they would like to say inside the classroom, to participate. So my question to Dr. Bاسم, as a matter of fact, how do you think we should handle those issues inside the classrooms from students who stammer or stutter as teachers or as physical therapists, in order to avoid similar situations, you know that what's our role and how can we help, support, and motivate those students? You know that we can utilize our authority inside the classroom to help them to a certain extent, of course. Thank you so much.
Most welcome. In fact, it is difficult to control the behaviors of the students in the classroom, but we make some suggestions to the teachers, to peers, and to parents concerning dealing with the stutterers. But in fact, you know that it is difficult to control students' behaviors in the classroom. I do agree with you that peers, teachers, parents may or can greatly help stutterers to overcome this deficit, but it depends on the situation, of course.
Okay, Doctor.
Thank you for the question.
Thank you,
Thank
Dr.
you so much.
There is another question in the chat from Ban Ahmed Hamoudi. She says, could the doctors cooperate with and rely upon linguists in their path of treating mental disorder patients? Can the doctors cooperate with the linguist?
Yeah. The linguist may interfere if the deficit has some relation with language, you see. So the applied linguist is concerned with language related problems. So if there is linguistic performance, if there are linguistic elements that can be analyzed, then the job of the clinical linguist is to analyze and assess this aspect of the deficit. He is not in a position to provide or to cure or to treat the patient. His job is to provide insights or suggestions to the therapist or to the doctor. So his contribution is subset basic, it seems to me. So his job is only to analyze the linguistic aspect of the deficit. Okay?
Okay, Dr. Bاسم, this is very clear.
Thank you.
Answer. Thank you so much. Any other? I think there is an announcement given to us from Nizar. He says that there is a conference on language as a second language, and he has given us the link. He says you can join me. Do you Nizar? Just a moment after this. Is it for today, this conference?
Not really, no. The conference will be done in October 2020, but this is just an announcement if somebody is interested from the colleagues, interested in submitting a proposal to the conference. And the conference is virtual, so you can do it from anywhere. So the focus is the teaching English as a second language, and I'm a board member with this organization. And so I thought maybe some people are interested, some colleagues, like in submitting a proposal within this area. So that I just wanted to share that with you. And I wrote down my email if somebody is interested in, do follow up with me after the session or later. But the conference is in October.
Oh yeah, 23rd of October to 24th. And the association, Washington Association for the Education of Speakers of Other Languages. So this is the conference. Yeah, thank you so much. You can,
exactly.
And one of you can have a look at it in order to see whether they want to participate.
Yeah, yes. Mr. Nizar, excuse me, Mr. Nizar, when is the last day for submitting the proposal?
I think it's the middle of September.
Middle of September, and the conference will be in October. Okay, thank you.
I think so, but all the details
Yes.
are in the link. Just I hope I'm correct in the deadline. But if you check the link, it will give you a clear idea and pictures about many of your questions.
Okay, thank you.
Yeah, welcome.
I think we are done with the questions, Dr. Bاسم, and we are done with our session and with this lecture. Thank you so much, Dr. Abdullah. What is the second step? What is the following step? Sorry, shall we close and go? Dr. Abdullah.
Thank you.
شكرا جزيلا دكتورة.
شكرا دكتور باسم على جهدك. شكرا للجميع على حضورهم وكانت محاضرة رائعة دكتور باسم، الله يعطيك الصحة والعافية. شكرا دكتور عبد الله على جهودك التي لا تقدر بثمن بصراحة. شكرا جزيلا.
شكرا للجميع دكتورة، شكرا لكم جميعا.
الله يسلمكم. Good night everybody. Good night everybody. مع السلامة.